Are you ready? All right. Hello, everyone, and welcome to Pathways to Liberation, integrating Black identity development, oppression, and liberation psychology for enhanced mental health. I am Imaje Harvey. I am a Black mental wellness ambassador who will be supporting this session today. And I would like to introduce our speaker, Dr. Raquel Martin, a licensed clinical psychologist, professor at TSU, and scientist.
Hey everyone. So I do terribly with time management. So I put a link in the chat specifically that goes along with the example that I'm going to use today, because my goal today is to provide brief overview and when it comes to liberation psychology, as well as Black identity development, and how we integrate that in terms of treatment planning, questions to ask, all that. So the link in the chat has the case example that I'm going to discuss. It also has some key terms that I use: racial centrality, ideology, salience, and regard. But it also has something that I'm sure we're not going to be able to get to today, because there's going to be so much information and trying to be mindful of time and give you an hour. So this is just key questions that I typically ask or keep in my head when I'm doing an assessment, and I want to be mindful of the fact that seeing as how I specialize in Black mental health and racism-related stress, these are things that I keep in my mind in terms of, are there any signs that they're experiencing racism-related stress? How do I integrate that in the treatment plan? So these are some just quick questions that I keep in my head, and honestly, sometimes I'll write down and integrate during therapeutic treatment about assessing whether your patient is struggling with some aspects of racism-related stress or some struggle with Black identity development. Okay, but let me share my slides. All right, here's the thing. I talk fast. Am I going to slow down? No, I haven't figured out how to do that yet. So I typically say buckle up, but I will try to be very mindful of that. So one of the aspects that I always talk about as a licensed clinical psychologist is that I also identify as a liberation psychologist. That means that I do everything in my power to work to integrate the aspect of socioeconomic and political factors when it comes to my patients. My work is always from a strength-based orientation. There is no aspect of focusing on deficits within my work. And then also advocating for change as part of the therapeutic process. I do that with my patients. I also do it outside of the session, and I encourage my patients to do that as well. As someone who specializes in Black mental health, as someone who specializes in working with patients of African descent, one of the things that I have found that contributes to well-being and decreasing feelings of hopelessness or powerlessness or isolation as a result of racism-related stress is finding some way to be an agent of change. And it doesn't always have to be a boycott or writing in letters. It doesn't mean it doesn't have to be that, but also identifying to the bare bones of what is resistance for you, what is being an agent of change for you, whether that is advocating for yourself, advocating for others, stating your needs, anything. But I really try to get to the bare bones of the fact that being an agent of change, being an activist, is thriving in an environment that works every single day to make sure that we are not seen and not heard. So our existence overall is an act of resistance. So when we integrate it in Black identity development, that's what I talk about a lot with my patients. Also, when it comes to Black identity development, this is actually a real book. I have it. It's by Baratunde Thurston, and it is he also has a podcast, I believe. It's not about teaching you how to be Black. There's one in the freedom of individuals and patients when it comes to their own stressors and Black identity is realizing that there is no right or wrong way to be Black. Right? Am I going to agree with the way that everyone manifests their Blackness? No, but that's not my job to agree or not. Right? I always state that being pro-Black is advocating for Black people, whether they show their Blackness in a way that mirrors my own or not. So this is in no way about teaching you how to be Black. There's no right or wrong way to be Black. If you're Black and you're having an experience, it is in fact a Black experience. So This whole entire aspect is going to be discussing, this whole entire presentation is going to be discussing integrating Black identity development. Black identity development provides individuals with a positive framework through which they identify themselves as individuals as well as members of their culture. I like to conceptualize it and discuss the conceptualization of your sense of belonging to your culture. Like, how much do I feel like I belong to the community of individuals of African descent? Do I have a positive evaluation of belonging to the Black community? Do I have interests in or knowledge about my community? And also, do I have an integration of some aspect of social activities? Do I feel closeness to them as a whole when it comes to thoughts and feelings and behaviors? And also realizing that this also comes into play with the intersecting aspect of your identities. There is places where I feel affirmed as a Black person, but not as a Black woman. There are places where I feel affirmed as a Black woman, but not as a Black mother. There are places where I feel affirmed as a Black Northerner, but not a Black, I'm not a Southerner, but I reside in Nashville, Tennessee. And there are many places where I'm like, oh my goodness, if I could just go back to the East Coast, it would be freedom, right? But when you're looking at this from the mental health perspective, always make sure you take the time to look at those intersecting identities. Because a lot of times when I'm having patients who are struggling with their identity development or struggling to connect culturally, it's because we're only looking at one aspect of their identity being affirmed. Yes, this, you get to check in with your family all the time and you have that aspect of Black culture being affirmed, but you have to mask when it comes to your sexual orientation in that environment. So maybe your identity as a Black person is being affirmed, but your sexual orientation and your queerness is not being affirmed. So you still feel like you're not being connected as well. So that's always something I say to check in on. It's not only about being Black. What about being a Black woman? What about being a Black millennial, a Gen Zer? What about being a Black tech person? What about being a Black psychologist? So a lot of times I find that people miss out on these glaring factors because they're only looking at one aspect of identity. So make sure you're talking about different aspects of social location, right? Because there's also the fact that you don't want to assume anything just because you're a Black person who may look the same, may have the same hair color, may have the same gestures. One of my best friends is Jamaican and she looks very similar to me. Everyone says that we look like sisters, and the way she was reared is very different than mine. We have some things that are aligned, but some things are also different. So I love the fact that I automatically get buy-in with my Black patients. I love the fact that it's like a cheat code, like, we here. But I also want to lean into the fact that just because I'm Black doesn't mean I know the exact aspects of your experience. So don't glaze over assessment. There's all these checkpoints and questions, whether you're looking at depression or anxiety, but nothing beats a good intake. And the only way you can get a good intake is with a good interview. So don't just assume just because like, oh, we Blackity Black, 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 I go to sleep with a bonnet too. That don't mean I know the intricacies of all your experience. And don't let your patient think that you know the intricacies of all their experience, because sometimes they won't share aspects of themselves because they'll be like, you get it, right? And I'll be like, I don't get it. And I need you to tell me about it. Tell me more, right? So sharing that aspect of it. Also, when you're looking at Black identity development, make sure you try to check in with different sectors of your patient, because these two things aren't always going to be the same. The how you think others perceive you and how you identify yourself can be incredibly different. So when it comes to Black identity development, when it comes to integrating this into therapy and treatment planning, in the living document of your case conceptualization, make sure you check into both aspects. How somebody perceives themselves may not be the same way that others perceive them. One of the reasons why it's so important to integrate Black identity development and racial socialization in a clearer sense of your ethnic identity is because I always state it is a shield against perceived racism and mental health difficulties, and it's a bridge to stronger self-esteem and academic achievement, moral development. You have a decreased likelihood of engaging in risky behaviors and substance use. It really is. It's just that girl, you know what I'm saying? Like that, it's that he, she, and they, right? So if you are not integrating some aspect of checking in to racial socialization, some aspect of seeing where you are with Black identity development, you are doing your patients a disservice, because a lot of times people think that it only happens during youth. It really only happens like, I'm only really thinking about this during childhood. No. Aspects of my identity have been changed all throughout life, especially coming into motherhood. So really making sure that this is something that comes in with the working document of when you're seeing patients, when you have assessment, when you're updating goals. When's the last time I checked in on how they feel about themselves when it comes to the Black community? Checking in on that too. So there are a couple of models of Black identity development. There is the crossed model, which I very much, I like that model, but the Sellers model is my favorite because I find it to be more flexible. And you'll see these definitions as well in the little Canva thing I gave you guys. But the key factors are racial centrality, salient, regard, and ideology. And what we're going to do when we go through our example is talking about how you would assess for all these things and then how they would help you with treatment. Like I'm going to give you the terms, but to me, the brunt of it, like the real, like, what is it, like gumbo or whatever, like I'm from Philly, so the real like cheesesteak aspect is us going through an example, right? And even if you're not able to engage, which is fine, you'll be able to see how I work through this process with my patients, and then use the skills as you will. So racial centrality, protective factor, just because they are, but it's your attachment and how you define yourself to other people within your ethnicity. For example, I always use this example. Some Black women may define themselves more in terms of gender than their ethnicity. Like, am I a Black woman, or am I a woman that is Black? And the reason why it's important to check in on this is because it's an important reflection of who you are, but you can also check in to see how much do individuals define themselves according to their ethnicity? How much is that central to you? I had a patient who was at an HBCU for undergrad, thriving, doing it all. She was a genius. And then she goes to a PWI for med school, and she totally had a severing of some aspect of her identity. Like at one point, the way I described it to her was like, if you're at an HBCU and you have to describe yourself, you don't typically state, like the first thing you state is like Black, because it's like, yeah, girl, we're all Black, right? So it was salient to a certain extent, but it wasn't like the central aspect of them. Instead of when she went to a PWI and they're like, so tell me about your ancestors. And she's just like, what the flip? We from Chicago, so like having that kind of conversation and trying to see where they feel in terms of racial centrality. How do they feel attachment and how do they attach and define themselves according to their ethnicity? And has that changed over time? Also, thinking about how individuals feel when it comes to their destiny being tied to that of other Black people, right? The reason why that's incredibly important is, racism isn't new, but it is very much filmed and recorded more. So also checking in on, you're constantly seeing people that look like you being harmed, being called thugs, being taken advantage of, and you feel like your fate is tied to theirs. How does that make you feel when it comes to engaging with people that don't look like you? How does it make you feel when it comes to hypervigilant and stuff like that, right? So this is why I always state, ask questions about that. Ask the way that, how do you feel like your fate is tied to other people of your community? Racial salience is talking about like self-concept and then self-esteem. It can change over time, but it's to extent to which it's relevant to your self-concept. How much do you really think about your Blackness in every way, shape, or form, right? And it doesn't mean that there's a right or wrong answer, but it does mean that it can help you to, as a clinician, key into things that may be simple to you that you're seeing objectively, but not to them, right? Like, say to them, you identify the fact that like salience is incredibly important to them. And when it comes to being Black, they identify themselves as Black. Every single thing they wear is Black pride. They go to every single poll, every single thing like that. And then you notice that there's been a decrease in that. You notice that their new work environment makes it so that they can't spend as much time in their community that they like to. They can't go to those events as much as they used to. And they're not putting two and two together to realize that that's what's contributing to anxiety difficulties or depressive difficulties. But you see it. This is why we keep an eye on things like racial salience, and you keep a heads up to see, I think I got to check in on this because this is someone whose racial salience is incredibly important to them. And yet I can't tell you the last time they told me that they hung out with their typical crew with stuff like this. Next, racial regard is whether you feel positively or negative about being in the Black community overall. Public regard is about how you feel other people feel about Black people. And then private regard is the way you feel about being Black overall. When I'm asking questions about racial regard, I'll say, how do you feel about Black people? How do you feel like Black people are viewed? What are some traits that you think of when you think of Black people? The reason why this is important is you can get some really good information about stereotypes that may be present in this individual's mind. And stereotypes lead to injected oppression, and it can really help you understand why some things are getting in the way in terms of them with progress, why they have these automatic negative thoughts that come up, because stereotypes are rampant in the world. We don't grow up in a bubble. So, Your patient is really stuck on behaving in what they see as like a very, I don't know, professional manner, or they took a really big hit when someone stated that they were aggressive, but they don't know why that is so impactful for them. There's no way to make progress with that patient if you don't understand the impact of their private regard and aligning themselves with something that may be seen as respectability politics, and how that is getting in the way of them processing an event. Right. And that's why Black mental health is a specialty, because if I sat here and somebody else had a patient and they're like, my patient seems really distressed about the fact that they have to change their hair before they go to an appointment or go to this job interview. And I don't see what the big deal is. Just change your hair. Right. Versus someone in Black mental health be like, tell me more about why you feel as though your identity is tied to your hair. Tell me more about how it feels having a new job and you can't get your hair done the way it used to. Tell me more about when was the first time you felt that your hair was getting in the way of you being able to join in with other people, right? That's the difference between Black mental health and mental health. There's a difference between depression and depression as a result of racial battle fatigue. So checking in on racial regard is really important as well. And finally, just the ideology. What does it mean to be Black? This one I find is really important because a lot of times it's linked in with respectability politics and jobs and activities. It really represents someone's philosophy about right and wrong ways to be Black. And I find that this comes up a lot of individuals, especially when they're linked very much into the church, which we know is a hallmark within the Black community. However, they may identify as queer, and how that gets in the way of them fully accepting themselves, how that gets in the way of them advocating for themselves and saying that God loves me too, how it gets in the way with respectability politics and stating that everything I bring into this space is professional because I'm a professional and I'm doing it. Right. So it's really important to also check in on these aspects of ideology, and really driving home the fact, if I find that a patient is having difficulty with the ideology piece, there is no wrong or right way to be Black. I know we like to say it because, Candace Owens and Kanye be damned, but there technically is no right or wrong way to be Black. That is just what it is. Like it's just, what did Harry Tubman say? We can't bring them all. You can acknowledge that, but you can also state that is still their experience as a Black person. You get to identify what it means to be Black in your experience. And so many times with patients, it will get in the way of their progress because they're like, well, I don't really, my mom said this, or I really enjoy doing this, but it's not really, I like my job working for someone, but isn't Black excellence only being an entrepreneur? No, it's a firm no. Right. I also find that a lot of times people struggle with this, particularly in the entrepreneur space, because I don't really think most of the time people want to be entrepreneurs. I think a lot of people were in environments that were oppressive and racist. And instead of trying to be in that environment, they decided to craft one for themselves. So I've even had to work with a patient and being like, okay, Black excellence is thriving in a community that tries to work every single day for you not to exist. You can have a boss and it'll be okay. You don't have to be, Black's excellence doesn't have to be this whole commodified, like I'm my own boss. Listen, as long as I'm bringing home those checks, you could be Black excellence, just so understanding that and how that may come up. And we all learn about like Black identity development through racial and ethnic socialization. One of the things to really keep an eye on is the differences in ways that people are socialized ethnically, and Black socialization, gender differences, as well as intentional and unintentional methods, and just check in with people to ask them questions about well, what are some of your relationships that you typically have? When was the first time that you found out that not that you were Black, but like somebody may have a problem with you because you Black, like gender differences in the way you were socialized, right? Like when as children get older, we change the aspect of protective versus proactive messaging. Protective messages talk about like this mistrust and biases. Proactive messages talk about empowerment and strength. And as children get older, and we know that they get adultified and they get seen as adults earlier, we tend to decrease the amount of proactive messages we're doing. We tend to decrease the number of times we say that hair looks amazing and your skin is glowing and your culture is a place of pride. And we do more messaging about don't be out late at night, take that hood off, don't run, resist, or reach for anything. Don't wear any kind of hoodie that's darker than light blue. We in those balances, they get off So instead of telling them about all of the amazing things about being a Black person, we're really just trying to keep them alive. We're parenting out of racism related fear. And that gets embedded in us. And we start living in an aspect of racism related fear as adults, right? So when you're talking to your patients, whether it's family, whether it's individual, whether it's children, make sure you keep an eye on the number of messages they're getting when it comes to racial and ethnic socialization. Do you notice that there's more of a protective messaging when it comes to bias and mistrust, and not enough messages about the strength within the Black community? Also pay attention to intentional versus unintentional methods. This comes a lot when I've worked with children and when I'm doing family therapy. I had a patient I'll never forget. She was a young girl. She's a dark-skinned girl. Her dad was dark-skinned. And she noticed that her dad engaged with women differently when they were light-skinned women, and just being like, wondering where these thought processes come from. And I'm like, the call is coming from inside the house. Did the dad know that he was doing that? I don't know. I tried not to physically and verbally attack him in session. I succeeded. I still have my license, but it was important to bring it in the room, right? Imagine the person, the most salient relationship, the man that you look up to, you watch him and you notice that he treats people, girls, young women differently if they look like you versus they look like someone else. Was he intentionally saying negative things about his daughter? No, he never said a negative thing about his daughter in his life. He loved her. But women, young girls, we watch everything. Young children watch everything. So also be aware of unintentional and intentional methods too. When I'm assessing for stuff like this to see where someone's at when it comes to their engagement, I'll be like, oh, okay. You notice any differences when people engage with others? Do you notice any differences when it comes to the way your children, your parents talk to people? A really good example is like, yeah, when my mom is on the phone with somebody from the electric company, I can tell because she talks different. But being aware of that, because when you look at these unintentional shifts, what are you teaching your children, or what are you teaching people around you when it comes to the amount of respect those individuals deserve versus one group versus the other? Who you change your voice for? Who are you put on your nice wig for? Who who you tell me to put like where your skirt is too short? What does that say about the people that you're having me shift for, or that I'm around? Are they more deeming of respect and stuff like that? So just being aware of that. I find it's really important to check in on that when it comes to children. But when you think about it, if you're dealing with adult patients, we internalize that too. So think about like, yeah, I always notice that, certain people engage better with individuals who have straight hair. I wonder if that impacts me not feeling right if I don't have straight hair, or stereotypes when it comes to straight hair, stuff like that. So I always say like nothing beats a good intake. And also, this is something that I find with like new trainees in the field. We know that people come to us to get help. We know that they need some aspect of solution. And because of that, a lot of times there's this rush to do like give coping skills and journals and homework and all that. Chill. Because if you walked into a doctor's office and they were just like, looks like we probably need to cut you open by looking at you, you would be like, it's going to be a firm no. That's what's happening when you're providing all of these solutions and recommendations, honestly, in the first, second, third, even fourth session. I just met you. I'm trying to learn more about you. I want you to understand this is a collaborative space. If individuals are itching to get solutions, be like, we can talk about some things, but I also want you to know that this is branch work and not root work. And it may not always work the way you want it to because we haven't gotten to the depths of stuff. So don't feel pressure to run to solutions and all of that before you get to know this patient, because this takes time. And the reason why it's so important to take that time is because Black identity development, racial socialization at every single age range is really going to be a protective factor when it comes to anything, fostering within themselves. When it comes to academic achievement, when it comes to moral development, when it comes to risky behaviors, everything. This is going to help them everywhere they go. Because at the end of the day, the thing that keeps me alive, the thing that keeps me going, the thing that helps me every single day is because I know who I am, because I know who I'm not. I know who I am, and I know whose I am. And that's all steeped in the aspect of like Black identity and growing up in Philly and my mom being like black all day. And even if you didn't get that growing up, it doesn't mean that there could be some semblance of that integrated in your patient's treatment plan, that you can gift them with that. And then they can leave that session and figure out a way to integrate that in their lives. Because there's no way you can't acknowledge that hearing about yourself in positive light and having positive representation and taking the time to integrate yourself in your community you can't say that won't make you feel good. It'll make you feel amazing. Okay, so how do we integrate this and integrate this information into treatment planning? This is really helpful when it comes to this little link I sent you. Now we can't go fully into it because I'm on slide 12, and when I tell you I'm supposed to be on slide 25, and I'm nowhere near there. So this isn't something that we're gonna be able to go into today. But when you're integrating this knowledge into treatment planning, when you're asking questions about Black identity development and their racial regard and their salience, that's when I want you to use the questions that are in the Canva link that you can click and download and stuff like that. Because I want you to think about some things we're keeping an eye out for. Individuals who struggle with Black identity development, individuals who are not being affirmed when it comes to their culture, who don't see themselves, who have lower representation, and anytime they do see themselves, they're seen as an antagonist, people who have to mask all the time, they are going to suffer from racism related stress. And some things I want you to look out for are signs of feeling of powerlessness, hopelessness, loss of identity, difficulty trusting others, difficulty trusting themselves, traumatic stress, lowered self esteem, and isolation. And I included like 2 questions for each of these topics that I just mentioned to kind of keep in your head. You can either ask your patient this directly, or you can kind of just like look at these questions, know that they're in your mind, and possibly integrate them into your treatment plan. To understand, like, if we're thinking about treatment planning, your case conceptualization is a living document. The treatment and recommendations are going to be a living document. We're asking about Black identity development because it's a shield against all of these things. But when the shield is down and you don't have an aspect of racial socialization and you're not in an environment where you don't have to mask, and I say mask and not code switch because people will mention code switching and most of the time they use it wrong. I'm a big fan of like words mean things and like root words. Code means language, switching means back and forth. I guarantee you most people are not code switching, they are masking. And the reason why it's so important to have different terms, because masking leads to quicker burnout, loss of identity, increased suicidal ideation. We got to give stuff the name that it is, right? Because the term of code switching has been so normalized that people think it's not serious. It is, but most people are not code switching. They're masking. They're creating whole avatars, hair different, voice different. They laugh different. They're not even standing as tall. All that. Imagine how that feels being in your work environment or your school environment, which half the time we spend more time in that anyway. And then you're putting on the mask and you don't even know who you are without it. Right. I'm getting up there in age, which is a gift. I ain't got a problem with that. Being older is a gift that's not afforded to many. But I used to use the example when it came to masking as the movie The Mask. Like, oh, you remember the movie The Mask? And, the more he put it on, the less he could take it off. When I tell you, these kids were like, was that like an 8-track or like, what was that, a cassette? What was that, a CD, a VHS? And I'm like, oh my God, this is my life now. So don't use the mask if you're talking to the kiddos. But if you think about that scenario, the more Jim Carrey put the mask on, the harder it was for him to take it off. We need to also check in environments when it comes to how hard is it for individuals to take that mask off. So we incorporate this into treatment planning by knowing the definitions of these words: ideology, centrality, knowing that it's going to be salient for your Black patient. You're never going to have a Black patient where racial socialization or identity development isn't a thing, and knowing signs to look out for, to see if they're talking about powerlessness or hopelessness or loss of identity, and using some of the questions that I gave you in that link to check in on it and come up with them on your own. Right? Like when I'm dealing with patients, and most of the time they come to me because of those kind of things, a lot of things come up. And tailoring that to your patient. You probably know many signs where it's just like, this person needs to get to a barbecue ASAP. I mean, I genuinely feel like if they just got to kick it with people that look like them, they would have a way better week. You know the signs, but you may not know how important that is to write those things down. Use your own toolbox, right? Like get into it. But the questions that I gave you are a good start. I always use this quote when I'm talking about this: race matters because of persistent racial inequality in society, inequality that cannot be ignored. At the end of the day, the reason why it's so important to discuss these topics is because lack of representation, or only negative representation, or trying to take away our ability to learn about our culture, or trying to put stereotypes on us, that is an act of violence against the Black community. It is an act of violence against the Black community. I am very intentional in my words when I say these are methods to combat this, because it very much is intentional. If we can identify seeing people that look like you as a strength and makes you feel good, talking about your culture as a strength that makes you feel good, being able to be yourself as a strength that makes you feel good, and we're constantly being in environments that work every single day to take that away from us, that is violence. So when I state combat these aspects of racism related stress and racial battle fatigue and having to mask, I very much mean like, and I'm also like, super violent. I'm East Coast all day in North Philly. I mean go to war, Not I mean like, then y'all not gonna bring me back. But like I am not saying that anyone on the Black Mental Wellness League told me to say go to war. I'm just saying make sure you make an effort and check in with patients. And don't assume that they're getting this anywhere else, because they're not. Another way to check into this would be to check in with how individuals are feeling when it comes to oppression. And I always state, it's not enough to say like oppression. There are so many different levels of oppression, and you need to, thank you, Dr. Cunningham. you need to know the different aspects of oppression, because each level is going to give you a different inkling into what kind of recommendation you are going to give to your patient, right? So, cultural oppression is when individuals' beliefs and values are taken away from them. Beliefs and values of a different system, like a European American system, are placed on Black people, severing them from their individual culture, right? Interpersonal oppression is when we're talking about on the one-to-one level, when we're talking about bullying and beatings and threats and harassment. Institutional oppression is when we look at the policies that are in place, educated in the integrated in the education system, in public policy and media. And I always state injected to internalize oppression. And the reason why I state this is because you only have to tell someone they are stupid 4 times. They will tell themselves they are stupid the 5th. And you can change the words to say that they're criminals or not respectable enough or not professional enough. It is injected. And then we internalize it. The negative messages are out there and we take them in, and they become a part of our skin, as much a part of us as our own skin. So we need to understand the different aspects of oppression that our patients are going through so we can provide recommendations accordingly. Because so many times people will be like, raging against the man. And I remember having a conversation. I remember having a conversation with this person, and as my students would say, I ate him up, because he said, you got to rage against the man. And then he was using all this misogynistic language. And I said, you're the man. Like, your institution of patriarchy is the thing that is impressing me right now. You raging against the man. I need you to look at the man in the mirror. Like, your messages are also oppressive to me, right? Ate him up. But so it's really important to give it a name, so that you can know how you're going to help your patients with this, right? So if we're going to incorporate this knowledge into treatment planning, if I'm looking at cultural oppression, I am going to suggest patients likely increase activities where they're able to express their culture, be around individuals where they don't need to mask, constantly checking in on that, seeing if they can build community with their individuals around them, but also outside of the session. If I'm looking at injected or internalized oppression, I am going to look at a lot of times we have to look at what I call is like a media detox. I'm really trying to check in on how many times they're ingesting messages that they don't even know that they're taking in. We're struggling with you dealing with the Jezebel or the sapphire stereotype, or feeling like you're not respectable enough. And every single book you read, every single TV show where they look like you, every single song where you listen to that where the person looks like you, they're degrading themselves. They're not affirming you, or you don't even read things that affirm people that look like you. How are we going to combat that injected oppression if we're not putting in some good? How are we going to get rid of all the bad if we're not putting in some good, right? So look at media. I want to know what kind of TV shows you're looking at, what kind of books you're looking at. And if you're not looking at any, I'm going to need to provide some. This is one of the reasons why I say it's literally my job to be well-versed and educated and read books and look at the documentaries and listen to podcasts, because I don't suggest stuff I haven't read or listened to. You're not about to give me, I'm over here suggesting, I heard a parent the other day was talking about how she recommended Bridgerton because, she was like, oh, I heard Bridgerton is really good. And said her child could read it, could watch it. And I remember and she's listed her reaction, and she said, I did not see this yet. And like, this was a really inappropriate thing for me to recommend to my child. So just make it a point to also ask your patients, what are you listening to? What are you reading? What are you talking about? Even if they're stating that, oh, I'm not ingesting anything negative. Like, even if you notice that like they're not ingesting anything negative, that's what's up. That's half the battle. How many times are you ingesting stuff that's positive? You get so used to coming up in school. I mean, it's not as difficult now because everyone is publishing books, and I just love that. But how many times are you ingesting stuff that does affirm you? No, you're not ingesting negative stuff, but how many times are you ingesting positive stuff? You get so used to having to learn about stuff that doesn't uh advocate for you that you forget to look out for stuff that advocates for you yourself. And yes, like Summer, just like you mentioned, like the news can be incredibly negative. I try to make sure I combat it with being aware, but also having the sense to know that if there is a zombie apocalypse, someone will let me know. Sometimes I do need to check in, but sometimes I do not. If we're thinking about systemic or institutional oppression, you would incorporate that in treatment planning by trying to think of ways to advocate for change within the environment that your patient is struggling with. Either you advocate for change in that realm, like say we got a lot of patients and they're coming in and they're dealing with hair discrimination, right? One way you can do that outside of the office is to look up the Crown Act and look up what the rules are in the state that you live in when it comes to hair discrimination and advocate for that realm. Another way is to find a way to help your patient become the change agent. You know, it occurs to me in session that a lot of times the things that you feel stressed out about are these messagings, whether intentional or unintentional, that something that you're doing is against the rules. And there's no policy that says what you're doing is not against the rules. Have you ever thought about making that a point to bring up at the next meeting? And changing the policy when it comes to discrimination. Yes, we talk about ethnicity and we talk about gender and we talk about sexual orientation, but your job policy has nothing about hair discrimination and discriminating against that. You ever think about taking that up when you go to work? Right? Because like we're not going to be the only ones who are able to do it, but emboldening them because we're working from a strength-based orientation and be like, you don't have to take that. Let's figure out a way for you. Let's workshop a way for you to advocate for that and put that in your treatment plan. And if I'm talking about interpersonal oppression, a lot of times I will talk to individuals about their injected messages. I will work with them to incorporate education to learn about the root of stereotypes, where they're coming out, their impact on you to normalize that experience. And if it comes to an environment where interpersonally people just suck, and it's terrible, a lot of times I'll work with my patients to see if we can come up with an exit strategy. Because a lot of times people think, well, I got to be able to leave tomorrow and that'll make me feel better. I walked into my PhD program. I was there for a month and I was like, this ain't for me. I just need 6 more years and I'm gonna get out. And even just counting down to 6 years, and it was like, if you count postdoc and internship, it was 8. Even counting down to that made me feel better. It doesn't have to be tomorrow. And you don't want to be one of those clinicians that are like, oh, just leave that situation, quit that job. That's not always the case for many people. But you can help them come up with an exit strategy. And since you're their mental health professional and you're on their team, you can work with them to identify ways to decrease the access to the places that are taking away what you feel is firm in your Black identity, and try to find a way to bulk up some skills and go into another environment. A lot of times I've had patients where we work together and they were able to cultivate the space to change policies and make themselves feel more comfortable in that environment, whether it's work or school. But I've also had patients who have had to leave. And when they're trying to leave, a lot of times we'll check in and I'll be like, listen, this is not the time to phone stuff in. Okay. This is the time where every single opportunity you take in, you need to think about how you're going to use that opportunity to talk about it at your job interview, because we have decided that you're leaving. Right. So work with them on that. Coming up with an extra strategy is we're just another person on their team. So when you think about this, we talked about the Black identity development. We talked about the aspect of oppression. Next, we're going to talk about the liberation aspect of it. How do we utilize liberation in therapy? With liberation psychology, of course. It's an antithetical to traditional psychology. It was developed by Dr. Ignacio Martin Barrow, and it is psychology for change in the system. It is very much a transformative approach that not only works to understand the psychological issues, but in the broader context of social justice and human rights, and empowering communities to change and challenge the oppressive systems that they're in. And this isn't only with our patients, this is with us. If you're at this conference, you're reclaiming Black joy in the community, you're a liberation oriented professional. You already got this. You just need to work on making sure that we're empowering this in your community, empowering this in your patients. If you're supervising students, empowering this in your students. Because I tell every single one of my students, every single one of my clinicians, listen to me. You got more days ahead of you than I do. I'm working with you because I need you to dismantle this system. Okay. I tell my students all the time, fix it or I'm gonna fail you. Okay. Like, like I'm a train the trainer model kind of person. Go forth and prosper. You hate that policy, change it. That's what we're working on. So you guys are already here. You're at this conference. You're already liberation oriented professionals. This is just providing you with more tools to do that. I am not going to have time to go over every single aspect of it. The biggest ones that I'm covering in my example are praxis, conscientization, as well as methodological shift. So quickly, praxis is teaching. Y'all get that, right? That's what we're doing. When it comes to liberation oriented psychology, you're looking at the role of theory, but also reflection and also action. It's not enough to like understand these issues. You need to also talk about how you're going to apply them. That's why throughout this entire presentation, I say like, here are the terms. These are the questions you ask. This is how it comes up. This is how it assesses, right? Some people get stuck in, I know what that word means. That's what's up. How do you apply it? How do I integrate that in my treatment plan? How do I teach someone else this skill? I love that you know the words. That is fantastic. I need to know how to integrate it though. It's the elevation between reading and then applying, right? Because not the aspect of solely that knowledge is power. It's like, yeah, to a certain extent, but I know people who know a lot of stuff and they don't know how to apply it. Knowledge is helpful. Let's say it's the plug or whatever. The application is like putting that joint in and letting the light come on, like a aha moment, right? So praxis is the way you apply it. Practice is going to be everything y'all learned this weekend, everything y'all learned today, how you're going to apply it in your own work with your patients so they can apply it to their own selves, because we all work in a system with your students, with your partners, with your spouses. That's praxis. Conscientiate, when I tell you I can't stand this word, and for someone who talks about this theory at least once a week, every time I'm like, they still ain't changed that word. How dare they? Conscientization is the process of developing consciousness and then applying it. So it's the application of the praxis, right? Like we have the education, you become aware of these factors, and then you're more equipped to challenge and change them. It's basically changing your mindset. But you can't change your mindset if you're only reading the same stuff. You can't change your mindset if you're only learning about Freud. You can't change your mindset if you're only learning about experiences that center you. I am a cisgendered, heterosexual Black woman who's a psychologist and very privileged. If I only learned from authors that look like me, I would never thrive and I would never be able to help my patients, right? So conscientization, conscious awareness is what you're doing every single time. And then when it comes down to it, the methodological shift is utilizing all this information to not only change the policies, but also think about ways you can come up with programs, research methods, policies, just applying all of that. I want to get to the example. And I was like, I'm going to be able to go through all these slides. And then the narrator said she was not able to go through all those slides. You got to know yourself, but then you also have to, I know myself and still lie to myself, and that's what therapy's for me. It's like, you're not gonna be able to do these slides. You right. I'm gonna still try. We're gonna break this down with an example. I'm gonna try to bring this all together. This is why the little Canva link is helpful. Y'all can probably hear that in the background. That is my dryer. Super annoying. Okay. So we have this patient, Jordan Ellis. Let's say Jordan is age 24, non-binary, graduate student sociology, presenting symptoms, anxiety, depression, and the symptoms have escalated over time. We're not gonna be able to read this, but let me give you the cliff notes, shall we? Jordan's like bright. Jordan's engaged. Lately, Jordan's been having more anxiety and depression during their studies, specifically recently when they're doing information about their thesis and they're doing a literature review, and it talks about racial disparities in academic settings. Basically, Jordan's learning about themselves and one of the things when it comes to literature reviews is I find it to be one of my favorite sections, and it's always the most stress-inducing section for me too, because you learn how much more we have to go. All right. So despite having a strong support system, having friends, understanding faculty, Jordan starts to feel isolated, right? And I state the aspect of isolation because we identify, you hear isolation, you hear powerlessness, you know that we're already needed to keep an eye on how disconnected they feel. Jordan's faced with microaggressions from classmates, subtle discriminatory practices within the structure. When you hear the word structure, I want you to think about institutional aspects of oppression. Because if you can come up with like a guideline, if you can come up with the aspect of a structure, if you can come up with a policy that is oppressing someone, then you can come up with a way to dismantle that thing, right? You can come up with words that are antithetical to that and state that this policy needs to be adjusted. Right? It's not enough to be abstract and say like, "Oh, I'm here to rage against a man." What man? It's different to say I'm here to rage against policy and the human resources aspect of page 3, article 2. Cool. That's something that you guys can check in with. And when you're thinking about this patient, also think about the fact that they're grappling with implications of their identity on their mental health, constantly feeling pressure to represent the community positively while also struggling with their own navigation. This is something that I call, one of the freedoms I feel as though with being a European American person is like Paul just gets to represent Paul versus, Keon represents every single Black man in the world. The amount of freedom that comes with only representing yourself is something a lot of Black people aren't allotted. And this is an example of what Jordan is experiencing in this environment, in this academic environment. Jordan is typically bright and engaged, but they're feeling bogged down by all of the literature review and seeing all the places that we have to go. And then constantly feeling like they have to represent every Black non-binary person in the world and having to answer for every Black non-binary person's opinion and feeling like it is exhausting. So how would I integrate the Black identity model in this to learn more about Jordan and possibly have a way to key in to see how it would help? If we're looking at the salience piece, I may ask questions like, do you feel that one aspect of your identity becomes more salient than others in certain environments? And if so, why do you think that is? I'm learning about your environment. I'm learning about places that affirm you more than others. And I'm likely going to try to check in and see if I can increase the time you're in those affirming environments or find other ways to, look at the theme of these affirming environments and say your affirming environment is restaurants and you go on Fridays. Is it possible to also go on a Wednesday or a Thursday? I'm also going to ask, what kind of support do you seek or wish you had in terms of your racial or ethnic identity or any of your social identity, right? Because I'm going to learn more about what you need. I'm going to take the time when I'm reviewing your treatment plan to see if I can look some stuff up and integrate that. And I'm also going to consistently check in on that with you. Hey, you stated last week that what you need to have more of a affirming space is to be able to check in with that, queer Facebook group. And that's your homework for this week. That's what I want you to do. And then I want you to check in on that. We'll check in on it next week and we'll see how that makes you feel. And how did that help you when it comes to your relation to your symptoms, right? When it comes to centrality, which once again is the extent to which you normally define yourself when it comes to your racial group membership. I'll ask questions like, how does your Black identity influence the decisions you make in life? How does your queer identity influence the decisions you made in life? What cultural practices or traditions that are connected to any aspect of your identity do you engage in? Have you noticed an increase or decrease in the way you engage in those environments? And bringing it really to the forefront of incorporating this in the ways that they can be helped and the things that you can identify. When it comes to public and private regard, I probably ask questions about like, how has being Black contributed to the person that you are today? How do you think people feel about you being Black and being queer? How do you feel as though that manifests? And how does that impact the way you engage with people? Do you have affirming spaces that make you feel as though you don't have to mask and that make you feel as though you being Black and being queer just adds to the amazingness that is you? And if you don't have that, how do we find that? Was the last time you read a book where someone that looked like you or sounded like you or had your intersecting identities was not an antagonist or the side character? When is the last time you read a book that was the main thing was about them? I'm going to skip around a little bit. Another way that you can incorporate this from the liberation aspect of it to apply the knowledge is I'd look at praxis, which is in liberation psych, in terms of personal, community, and also therapeutic. When I think of the personal aspect, I am going to encourage Jordan to participate in activities that don't only allow them to reflect on their experiences of oppression, because we want them to ask themselves questions, but also initiate joining peer or support groups that focus on mental health, Black queer students, non-binary students, and can allow them to engage in some aspect of social activism, right? Because when it comes to praxis, we want to encourage Jordan to engage in activities because praxis is application, right? Engage in activities that affirm their identity and then counteract the oppressive structure. So personally, We want Jordan to engage in activities. We want you to educate yourself in the oppression, but I want you to engage in activities that affirm you. Therapeutically, you can also work with your patient to possibly role play. How are you going to deal with instances of racism or transphobia? How are we going to work with assertiveness or cultivate resilience within you? Right. Anytime you do that with the patient, you're working from a liberation oriented perspective, because it's not only about you being good in the session, it's about you being good out there. And I'm not only going to talk about, thoughts, feelings, and behaviors. I'm going to talk about the things that intersect with the thoughts, feeling, and behavior, racism, homophobia, and stuff like that, and find ways for you to affirm yourself. Because once again, I can't go with you everywhere. We're going to liberate you in your mind. And at the end of the day, most of the work is done outside of session anyway. If you have someone who's seeing you weekly, which is incredibly difficult for a lot of people, weekly for therapy, 1 hour a week, that's like less than 1% of your week. If they were only doing the work in session, they wouldn't make any progress. So you make sure that when you're being liberation oriented, you're affirming your patient to be like, they're like, oh, you're helping me so much as the clinician, Dr. Martin. You're doing all the work. I am not. I see you for 1 hour. And if you only did the work during the hour, you wouldn't be making any progress. When we think about the praxis, we're like, what you learn in here goes outside of session. And that's how you're helping them to liberate themselves. When we think about the methodological shift, which is another aspect of liberation psych, you really want to focus on the fact that you're not going from the traditional method. And the traditional method is very much deficit based, not talking about culture, talking about difficult topics. You're going to think about structuring everything in a collaborative aspect. You're going to think about utilizing strength-based orientation. You're going to recognize and validate feelings and experiences related to racism and transphobia. Also allow them to draw on their inherent strengths and the strength of their community. And you're not going to act like this isn't an issue. Right. One of the reasons why I give patients a document when it comes to people, a document about consultation sessions and learning more about your clinician before you take them on, is there's no clinician that I can work with where racism isn't going to come into the room. I need to know your comfort level with discussing racism. I can't work with someone who doesn't see color. You don't see color, you don't see me. Right. If you're working from a liberation oriented perspective, if you're centering this aspect of Black identity development, that is going to come in the room and you need to be able to discuss it. If you're not educated on the aspects of intersectionality of Black queer identity, then you shouldn't be working with that patient before you educate yourself, because it's not their job to educate you. Right. So this goes for us too. And last but not least, the conscientization. Oh, it cut it off. Oh my gosh. Embarrassing. With the conscious raising piece, you have to be aware of the structures that perpetuate the inequities. This is where education comes into place. You have to educate, then you acknowledge, and then you apply that education, right? Increasing yourself and your patient's awareness of the socio-political context that affects their mental health. I remember I was doing a consultation with a company, and I will always think about the fact that this Black man stated, the incident, the domestic terroristic incident that happened in Buffalo had just happened, or was something similar to that nature. And their boss asked them about, it was some TV show. I always say Game of Thrones, but I don't think it was Game of Thrones. And they were just like, there's no part of me that cares about this, right? It's your job to be educated so that you can make a connection, and also so that you don't alienate your patients. And it's our job to be educated in the first place. I had someone comment on my page when I mentioned the fact that, like, mental health is not the place to not know what's going on in Gaza and state that you don't have an opinion. You can state that you have an opinion, but you do, and you may feel like not feel the need to share that on social media. But when your patient comes in and they are dealing with the impact of not feeling seen in this world, and then they come into session and they're dealing with a clinician that also makes them feel unseen, because they don't know what's going on in the world, they don't know how to form an opinion, and they don't even feel like they can share that in this space. All you're doing is providing another unsafe space for them. Right. So when it comes to consciousness raising, this is the difference between I identify as a clinical psychologist and a liberation psychologist. It is harder. And honestly, there should be more gatekeeping in the individuals who are allowed to call themselves licensed mental health professionals, because the education that most of us received didn't center us. And it should. We're Black people, we're people of the globe, and people of the global majority are the global majority for a reason. If you are not being educated in a way that's anti-racist or liberation oriented, I personally don't feel as though you should have a license, right? It's an honor to have this job and be in this space. So when you think about the steps and the extra steps that are needed to take, they shouldn't be considered extra steps, but they are very much a requirement. I'm pretty sure I'm at time. It says 54 minutes. Yes, I'm at time. I'm going to stop my screen. I do not know if I have time for questions. I am so sorry. Well, I'm not sorry. Like I really need to just acknowledge the fact that an hour will never be good enough. But I very much hope you guys got something from the hour, and that it was helpful, and that you're able to apply this going forward. And I don't know if somebody's gonna pop up, and I should just like, am I? Should I? There's Dr. Kim. I'm like, what you want me to do?
I was trying to wait to see if someone was going to add a question to the chat. I know you're at time, but I didn't know if you wanted to do one question or not. I was waiting, but
I saw one. I see Faith Girton. How does this work apply to mixed or multi-race individuals, especially those who are white passing? And as a Black provider, how can this information be used with white clients? I'll be real with you. I don't. When it comes to how can this information be used with white clients, I think it depends. There is this space of thinking. My job is not to. I wouldn't work with a European American patient who I had to work through their racism with them or work through their prejudices with them. That is not my role. I specifically believe that I honestly think it's European American clinicians' role to get individuals who need to focus on those kind of things in line, and individuals will be more receptive to that. Like it's the same way Black people are more receptive to us the majority of the time, but also it will be damaging for me to do that. Right. This work would apply to mixed and multiracial individuals in many ways. There's a mixed identity development model as well. Dr. Jennifer Noble, who is also a licensed clinical psychologist. She also has a social media page, and she guides individuals and patients and does a coaching session through this. But it also depends on how this individual identifies when it comes to their culture. They may identify as mixed race, they may identify as Black and also European American, but they may not. So it really just depends on how they identify. But when it comes to racial centrality and ideology and private regard and public regard, this can be altered, and the questions can be asked for any aspect of culture. Anytime you want to make sure this person is feeling affirmed in their space. It was developed for Black people, and it's developed in that model. And I always center Black people because I focus on Black mental health. But being used with white clients, I think when I've done these talks, not with white clients, but when I'm doing this in the corporate environment, one of the things I really have to bring home is that there's a difference between like whiteness and then like European Americanness and European American and white supremacy. Right? Like people will get upset when I say European American, and I'm like, I say European American, I'm trying to help you out. All y'all got y'all 23andMe. Everybody wants to tell me how you're like 23% something. I feel like it provides more honor to your culture saying European American, but also my goal is not to make you feel attacked by discussing white supremacy. You need to identify the fact that white supremacy and then what you identify as your whiteness is separate. You can also understand that if you have these two circles, that if you notice that Venn diagram overlaps a lot, that's work that you got to do. But I am in no way stating that every single European American person is a white supremacist. I will state that every single European American person has benefited from white supremacy. The same way every single Black person and person in the global majority has suffered from white supremacy, and acknowledge the fact that that's work that you have to do. But my job is not to make you feel bad, but it's also not to not acknowledge what's going on. You need to take the time to acknowledge, if you're a European American person, what do you identify as your culture? And what is white supremacy culture? And do those things overlap a ridiculous amount? Because that's inherent. That's ultimately the problem. Because they're not the same, but a lot of people wield them the same. That was the only question I saw.
Okay, well, thank you so much, Dr.
Yeah, thanks for having me.
Of course, and tell them where to follow you on social media, because she has great videos, lots of social media interaction.
Oh yeah, it's Raquel Martin, PhD. Raquel Martin, PhD. And also that Canva link that I shared, my QR code is on there, and if you scan that, you'll get all the information as well. But yeah, I do share all this information online too, because there aren't many spaces. I mean, this is an amazing space that centers that, but there aren't many spaces that actually get to center that. It seems like more work. I remember talking to a clinician, she's European American clinician. She said it seems like a lot more work, and I said it only seems like a lot more work because it wasn't integrated into your the work that you should have gotten during education, and that's a failure of the institution. So it shouldn't feel like more work. You should have gotten this. You're trying to catch up. I've had to take extra courses just to make sure I got to center people that look like me. So it shouldn't feel like work. Change the system. Oh, my boys just walked in. They about to go crazy.
Well, thank you so much. We appreciate you. You have all her contact information. Open the Canva link and then follow her on all her platforms. Thank you so much for sharing
Thank
your.
y'all for having me, and thank you for providing this amazing space. This is amazing. I know you're going to get all amazing reviews, and when you do it in person, I'm going to be there.
Yes, yes. Take care.
Thank you.
I'm gonna bring.
Hello, everyone. Thank you for staying with us until the end. This has been a phenomenal conference with some dynamic speakers. We're just going to give some closing remarks. For all CE learners, I just wanted to give the reminder that you should complete all of your evaluations that you attended sessions for today and directly email them back to me at drbusby@blackmentalwellness.com. And I just want to give you the reminder to be sure to include your CE attendance word for each session that you attended. I want to also make some brief comments as it relates to sponsors. So we just want to thank our sponsors who provided our giveaway prizes today, Confirmations and Pieces of Me Behavioral Health. Also, thank you again to the Eating Recovery Center and the Pathlight Mood and Anxiety Center for their platinum sponsorship. We are so appreciative. Also, we wanted to make everyone aware that Black Mental Wellness has a number of upcoming events. Our very first event of the new year will be our annual virtual vision board event, which will be held Sunday, January 7th from 1 to 3 p.m. The link will be dropped in the chat for you all. And so those are my really brief comments as we wrap up today. Thank you again for staying with us until the end. And I'm going to go ahead and pass it to Dr. Cunningham.
Hello, everyone. Thank you so much for being with us today. We hope that you all feel fulfilled and excited to continue to do the work that you do to support the Black community. I just want to give a huge, huge shout out to our wonderful volunteers who have been supporting all of our sessions today. We've had ambassadors and mentors and mentees and interns, and everyone has been so wonderful. We would not have been able to pull off this conference without you all. So thank you so much for all of your support.
And I just want to close out today. This has been an amazing day. When we started both Black Mental Wellness as a platform and this conference, we wanted to make sure we had safe spaces to talk about Black mental health, where we had people who looked like us, who were doing the work in the range of ways that they're doing it, and that we can all learn something and feel seen and heard, and hopefully take some things home after the conference today. So again, thank you all for your attendance. We truly appreciate all of your support and for showing up and the engagement today. We look forward to more conferences, having you come back and enjoy and joining us in the future. And next year, the conference, it's been the first Saturday of each month. So it'll be of each November, sorry. So it'll be the first Saturday of November 2024. But thank you all so much for your attendance and for making it through the end of the day. We really appreciate you. Thank you.